everyone. My name is Erica Watson with Health and Wellness. Today we are joined by Dr. Philip Katz. He is one of the Philadelphia region's top gastroenterologists and clinical researchers of digestive disorders. Thank you for joining us today, Dr. Katz.
Thank you for having me, Erica.
Thank you. So let's just get right into it. What is acid reflux disease?
So, Erica, acid reflux disease to most people is heartburn, a burning feeling under the breastbone that occurs predominantly after meals and when lying down. That is due to acidic contents from the stomach returning upward into the esophagus and upward towards the mouth. Really, it's a disease in which stomach contents regurgitate or reflux into the esophagus, predominantly because the muscle at the lower end of the esophagus, the esophageal sphincter, malfunctions and allows those contents to reflux into the esophagus and cause symptoms or damage. The predominant symptom is heartburn, or that burning feeling, but there are other symptoms that go along with it.
Okay. So Dr. Katz, when does heartburn become serious enough for a patient to seek the care of a gastroenterologist?
Erica, that's a great question, and it's not a hard and fast answer that I'm going to give you. So, we have a number of medications that are available over the counter that have been approved for people to use to self-treat. And they have various labels. The proton pump inhibitors, for example, like Prilosec and Prevacid and Nexium and Zegrid, all have short-term approvals to treat heartburn for up to 2 weeks, and then can be used periodically, and if you need it more often than that, you're supposed to see your doctor. In reality, the guidelines that we like to say is that if you have heartburn more than twice a week, then we would strongly suggest that you see a physician. For each individual, that could vary. But in general, that's usually the way I like to think about it. So more frequent than twice a week. If heartburn wakes you from sleep, if the pain is really intense, it becomes a little bit more tricky. But a useful guideline is more than twice a week.
How do you diagnose acid reflux disease as opposed to, just it being a random occurrence of heartburn?
So, again, Erica, diagnosing reflux disease is based on first having symptoms that are consistent. So as we have already mentioned, heartburn, and there's a classic description for heartburn, this burning feeling that arises up under the breastbone like it's coming up towards the mouth after a meal or when lying down, or any kind of burning in the chest. There's a symptom called regurgitation where people feel their stomach contents just rapidly coming up into their chest. So a physician or a care provider, a nurse practitioner, can make the diagnosis clinically, so to speak, and give a medication, and if the patient responds, that is some evidence of disease. And then we have some diagnostic tests that we can do. We can do what's called an endoscopy, where we take a lighted scope, usually with sedation, but it can be done unsedated with some newer techniques, is passed into the esophagus, and the lining of the esophagus can be looked at for visual damage that is able to be consistent with reflux disease. And then there are prolonged monitoring studies that we can do. We can place a small capsule in the esophagus and monitor the patient for 2 to 4 days and see if they're having an abnormal amount of acid exposure. Okay. And there are tests that can be done with various types of technology to diagnose the disease. So a combination of clinical judgment, the history, and an examination with diagnostic tests.
Which treatment is what's the typical outcome for a patient with acid reflux disease? Can this disease be cured?
You've asked me a real series of great questions. Reflux in and of itself, because of what is actually going on in the esophagus and in the environment in the stomach, for the most part we don't consider a curable disease, in the sense that we can give you a medicine for a week or 10 days, it's gone and it'll never come back. So it's really not like a strep throat or pneumonia. It's a little bit more like some chronic diseases, maybe not as serious in the sense of something like hypertension or diabetes, although it can be, but it is something that usually recurs. So under most circumstances, people require some form of treatment over time. Sometimes more intense than others. That's why some people can be managed with over-the-counter medicines, and other people need to take medicine every day. And some people might prefer or even need a surgical procedure to reduce the potential damage from reflux. So there's a large menu of options to make this go away. I would say blanketly, almost everybody, if they're effectively treated, should feel better with this disease and have their quality of life improved and their symptoms reduced dramatically.
Can acid reflux disease be a symptom of something else going on?
So the way I would answer that question is the following. So heartburn, or burning in the chest pain, or another symptom like trouble swallowing, could be due to a multitude of diseases, which is why if it's frequent, or if you have any of those other symptoms like dysphagia, meaning trouble swallowing, then you should come see a doctor. So quite honestly, if you're in the appropriate age group, chest pain, you think about heart disease. Heartburn, if you think about it, suggests that it may be the heart. And then there are some other diseases that can be associated with those symptoms. Acid reflux is acid reflux, but the symptom could be due to a multitude of diseases that a physician would have to decipher.
Should patients of a certain age have an annual checkup with a gastroenterologist?
You know, that would be a wonderful thing if everybody could see a gastroenterologist for an annual checkup. And at a certain point in everyone's life, we would recommend that they get screening for colon cancer. But when it comes to acid reflux, quite frankly, primary care providers of all types are the first line of treatment for this disease most of the time. And there will be a variety of different situations in which people would be referred to a specialist. In this country, fortunately, people often have a choice of where they get their medical care. And if somebody felt that they might have symptoms of acid reflux, it would be perfectly reasonable to see a gastroenterologist directly. But annual checkups are really not necessary to look for this disease.
Once a patient has been diagnosed with acid reflux disease, what is the typical diet plan that they must follow?
So, Erica, the diet, well, the dietary modifications, as we would like to put it, that we talk to patients about, or that people talk about, is really rather interesting, because the word on the street is that you can't drink orange juice, you can't have tomato products, you can't have tomato sauce, you can't drink coffee, you can't do anything like that because you have reflux disease. And there are many acidic liquids, like those that I mentioned, and even Coca-Cola, and acidic foods, that can cause esophageal burning in people with reflux. Now, stopping them doesn't necessarily cure the disease. So in that case, every individual is different. So we talk to people about certain things, and in some people we do some things and not others. But there are a couple of keys. If you eat late at night, particularly right before you lie down or go to bed, then you're going to reflux more. So that is clearly a lifestyle modification that we want everybody to make. So in some senses, it's not what you eat, but when, or perhaps how much. And sometimes we like to joke about your mother being right, because if you eat your meal quickly, you tend to reflux more after the meal than if you eat your meal slowly. Very few people take a half an hour to eat anymore. But if you do take that long to finish your meal, you're likely to reflux a little bit less. Okay? And the big piece of diet is, if you are overweight, to lose weight. And it is fairly clear, certainly, that if you gain weight, your reflux can be worse. Obesity is a risk factor for complications of the disease, including Barrett's esophagus and potentially esophageal cancer. So losing weight is something that we would recommend. Small meals would be nice. A little lower in fat would be nice for everybody. But those are the major things. And then if you smoke, to stop. Because that makes everything worse, but it also makes reflux worse as well.
Okay. And what are some of the medical advances that have taken place in treating the disease?
Well, traditionally reflux, acid reflux, heartburn has been treated with medications. And from antacids to what we call H2 blockers, which are, in terms of names that people are most familiar with, like Zantac, Integument, and Axid, to name a few. And the most common treatment are what we call proton pump inhibitors. And I mentioned a few of those: Prilosec, Prevacid, Nexium, Protonix. I don't want to leave out anybody. Dexilant, so that nobody will get angry with me. I'll try and mention all of them if I possibly can. And those medicines have been tremendously successful over the past almost 30 years that they've been available in the United States. So the majority of people are treated successfully with medication, whether it's daily, whether it's on an intermittent basis, whether it's with higher doses than that, depends upon the patient. But there are a fair number of people who are unhappy on medicine, who still get symptoms. You may be aware that people have talked about some side effects from these medicines, and therefore it's been kind of nice to see that there are some procedures that have been developed that make surgery a little less invasive than it has been in the past. There is a new magnet device that can be placed around the esophagus that has been very promising in its ability to treat reflux in the right situation. And there are several new procedures that can be done through an endoscope that might be able to reduce reflux to a point. And then people have worked very hard at making the traditional surgical procedures as safe as possible if they're necessary. So new drugs, not many recently, but people are always looking, and several new devices and perhaps surgical treatment that might be available to treat the disease.
Thank you for joining us today on Health and Wellness. Thank you, Dr. Katz, for speaking with us. We will see you next time.
Thank you for having me.